doing a series of images, and this procedure requires for you to have a injection in your arm. Go ahead and lay down for me. Is that okay? So you already signed the consent, right? So there's a paper that you should have where the patient reads all the possible reactions to the contrast media, including death. And if your patient doesn't speak that language, you have to find a form that is in the patient's language or have someone that translates that. Okay, so she did that. I'm already here. The first thing I'm gonna do before the injection and everything, I'm gonna take a scout film. So my first scout will be a KUV normal, kidneys, uterus, and bladder, right? And then my second scout will be a cone down of the kidneys specifically. So I do 2 scouts, 1 full and then just 1 with the kidney center. I go show it to the radiologist. The radiologist comes back, and by then I have everything ready here, right? Remember, you should have everything set up. You don't want to be looking for things last minute. This is for the cystogram part if my patient came in with the, there you go. So the first part I'm gonna do is have everything ready for the radiologist. Thank you for the gloves, I forgot about that. My marker's ready. This is part of the, so here, I will have the injection already with the contrast withdrawn, okay? Everything ready to go, Band-Aid, da-da-da. So doctor comes in, needle, checks it out. Both of you guys had already been a puncher, so you know which vein and the whole procedure for doing this, what they need, what required, right? So radiologist comes in. Okay, how you doing? How you feeling? Da-da-da, pretty good. Okay, injects, goes. Okay, this is a bolus injection because it's all at once. In the meantime, what's gonna be happening, we're gonna start seeing our first minute. You gotta be right on it. Okay, the radiologist might look at you. Feel okay, ma'am? Do you feel like vomiting? Nothing is happening? Okay, so he's gonna walk away and say, take your images. So by now, the first thing I'm gonna do, since I was already set up to do a cone down, right? The first one will be at the 1 minute, and it will be my, whatchamacallit? What's the image that shows the outline of the kidneys barely? The flush. So the flush. So I take 1, so I'm gonna do this. Remember, the first few, you're not responsible for doing, but I'm gonna demonstrate how it goes. So kidneys start showing up, this is your first image. This is the 1 minute, you will be labeling it. Okay, you look at it, it's good, okay. All right, take it out. Okay, so now the next one will be the 5 minutes. You come in, take another one. But then you start seeing a lot more of the kidneys. Then you do an 8 minute again. Same positioning, right at that. There was one point where we did tomos, okay, right in here. By then you had already measured your patient and divided it into the measurement into equal levels. And then you will do your tomograms at this point. You set it up on your control panel and the 2 will move and kind of slide the kidneys this way and give you, every time you gotta change, okay? Then you do your, then you do a 10-minute full KUB, because now you will be having some contrast now going down here. So you makes sense that you're gonna do